Good day, Wonder Nurses. I'm Nurse Anne. Our video for today is about a topic that you can find in almost all nursing practice questions. These are the ethical and legal issues in nursing and some computations. So we will try to answer 13 questions about this topic, then we will go through the answers and rationale of each question. I will give you 30 seconds to answer each question, but if it is not enough, you can pause the video, but don't take more than a minute in answering. This is a way to practice time management during your actual exam and to prevent overanalyzation. So get a pen and paper. Let's start. Question number 1. Before we proceed with answers and rationale, please don't forget to subscribe to our channel and check other social media platforms to keep you updated. And you can also share it if you find it useful so we can help more students. Thank you, and I really appreciate the support. Let's now proceed to the answer and rationale. For question number 1, the correct answer is letter C. The action of the nurse is unethical because she breaches the confidentiality of the patient. Always remember that if the nurse is not assigned to the patient or the person doesn't have any consent from the patient, it is unethical to review his or her chart. Question number 2. Let's discuss some of the virtues of nurses. The scenario is a good example, which is also very common in the hospital, especially if the nurse is too busy and they forgot to return to their patient who asked for something. Temperance is controlling our behavior or action. Prudence is being careful in our decisions to avoid the risk. Justice is being fair. Finally, fidelity is being loyal or keeping promises. So the correct answer is fidelity. For question number 3, DNR or do not resuscitate. It is important to always check the consent if it is signed and updated. If the patient is under DNR, they will continue to take care of the patient, will not withhold any comfort measures from the healthcare team, and if the patient experiences cardiac arrest, they will allow natural death and will not perform any heroic measures. Therefore, the correct answer is letter B. Question number 4. In these choices, the first is the spouse, followed by the adult child, then the adult sibling. Next is the grandparents. Finally is the guardian. Therefore, when acquiring consent from the patient's next of kin, the correct sequence is the letter D. Question number 5 is a simple computation. The order is 40 mg of omeprazole. The stock dose is 40 mg per 10 ml. The formula is doctor's order divided by the stock dose multiplied by the volume. So it will be 40 mg divided by 40 mg times 10 ml equals 10 ml. Therefore, we will use 1 vial in every administration. In the ER, they administer 1 dose at 6 p.m. The next dose will be on December 29 at 6 a.m. and 6 p.m. because it is Q12. Since it is Q12 for 48 hours, it will be same frequency until day 3. From day 4 to the 7th day, which is on January 3, it will only be OD or once a day. Therefore, the correct answer is 9. 9 vials for 1 week. So it is letter B. For question number 6, let's first define the following options. Respondeat superior. This means let the master or the employer be responsible for the action of his or her employee. Res ipsa loquitur means the thing speaks for itself. Damnum absque injuria. It means there is damage, but there is no unlawful act. The best example of this in the medical field is chemotherapy. Captain of the ship. This is usually in the operating room, where the surgeon is the most accountable for the patient. We also have force majeure. It is when unforeseen or uncontrollable circumstances happen, like typhoons, earthquakes, or disasters. Considering these points, the correct answer is letter D. Let's now proceed to number 7. Always remember that the role of the nurse during the signing of consent is we act as a witness, while the physician is the one who obtains the consent. Question number 8. The best response as a nurse is to ask them to secure a written medical prescription from a physician. This is for you to avoid a legal problem. We don't just administer medications even if we have the license to do so, but we also need to take safe action for our clients and for ourselves. For question number 9, same formula. Doctor's order, which is 375 mg, will be divided by the stock dose, which is 750 mg. Then will be multiplied by the dilution, which is 6 ml. Therefore, the correct answer is letter D, 3 ml. Number 10. Let's define the following. Assault, it is a threat or an attempt to inflict harm to a person. Negligence is the omission or commission of an act that fails to meet the standard care for the patient and results in mental or physical harm. Invasion of privacy, you already know that. Then the battery is the intentional act of causing harm to someone. Therefore, the correct answer is letter A. For question number 11, let's discuss first the various circumstances that would affect criminal liability. Aggravating. There is an increase of punishment if someone is violating or committing a crime by using their public position or money. Justifying. There is no criminal liability because the action is considered a self-defense. Mitigating. It is when a person is less than 18 years old and greater than 70 years old. The punishment will be decreased. For exempting, there is a criminal liability but lack of culpability because the person is less than 9 years old, imbecile, or insane. Therefore, the correct answer is letter B. For question number 12, the correct answer is letter B. I'm not an expert in law, but let me simplify it. We have two types of law, the public and the private law. In public, we have the violation of the criminal law, like felony and misdemeanor. A felony involves serious crimes, like murder or robbery, while misdemeanor is a less serious crime like vandalism or shoplifting. The punishment under this is fines and or imprisonment. On the other hand is private law, that is a violation of civil law. In civil law, we have what we call a tort law. Libel cases fall under defamation or character assassination, which is an intentional act under tort. The punishment is damage, which means harm or injury, or damages, which means money. Another example of an intentional act is assault, battery, breach of confidentiality, and invasion of privacy. While there is also what we call not intentional, which is negligence. For our last question, we have question number 13. Republic Act number 9173 is, we all know about this, it is a Philippine Nursing Act of 2002. Public Act number 2808. This is the first true nursing law. It was created by the Board of Examiners in 1919, and the first board exam for nurses was given in 1920. Proclamation number 539. This is the declaration of the last week of October every year as Nurses Week, and authorizing the Filipino Nurses Association to take charge of the observance of this law. Finally, Presidential Decree number 651, which is signed in January 1975, that mandates the immediate registration of births and deaths in the Philippines. Therefore, the correct answer is letter C. Good job, Wonder Nurses! If you want more discussion about nursing ethics, nursing law, and computations, you can check the link that I will provide after the video and in the description below. Thank you for your time. Keep safe, everyone.
Thank you for listening. I hope you learn and understand something. If you want more videos, don't forget to subscribe. See you on the next video.